A first aid kit matters. It's something every prepper should have, but it is not a medical preparedness plan. If the pharmacy closes for 3 days, your first aid kit will not refill a prescription. If a storm knocks out power, it will not keep insulin or other refrigerated medication cold. If someone has asthma, diabetes, heart problems, severe allergies, mobility issues, or sleep apnea, a box of bandages will not solve that problem. A first aid kit also will not replace medical records you cannot find, or teach someone in the house what to do when you are the one who gets hurt. That is the gap this video is about. Real medical preparedness starts with the people in your home. What medications do they rely on? What health problems already exist? Who needs glasses, hearing aids, mobility support, special food, or powered medical equipment? Who would struggle most if doctors, dentists, pharmacies, or hospitals became harder to reach for a while? This is not about pretending to be a doctor. That mindset can get people hurt. It is about handling the things you can deal with now, before a storm, cyber attack, evacuation, supply shortage, or local emergency turns a manageable problem into something much harder. So in this video, we are going beyond the first aid kit and looking at medical preparedness in the real world. Prescriptions, training, hygiene, chronic conditions, family medical plans, records, reference books, and the mistakes that leave preppers exposed. Welcome to Prepper's Paradigm, your channel dedicated to practical prepping and disaster preparedness. As always, I use a computer-generated voice because my own voice can be difficult to understand due to an injury. Today, we are talking about medical preparedness for preppers, but not as another first aid kit checklist. I have already covered first aid kit contents in a separate Prepper's Paradigm video and article. That one looks at supplies, kits, and medical gear for bugging in and bugging out. I'll link it in the description. This video looks at the bigger problem. How do you prepare when healthcare becomes harder to access? That could mean a closed pharmacy, a canceled appointment, a hospital under pressure, a dentist with no available openings, a cyber attack affecting records, or a power outage that creates problems for someone who depends on medical equipment. This matters because medical problems do not wait for normal life to return. People still need prescriptions. Kids still get sick. Teeth still crack. Chronic conditions still need attention. Injuries still happen when people clear debris, use tools, cook without normal utilities, move heavy supplies, or work under stress. So the goal here is not to replace doctors, dentists, pharmacists, or hospitals. The goal is to reduce the problems you can prevent, prepare for delays, organize the information your household may need, and know where your limits are. We'll cover the real medical problems preppers need to plan for: prescription medications, first aid training, hygiene and sanitation, chronic conditions, family medical plans, records, reference books, common mistakes, and where to start this week. Let's start with the real medical problems that can affect preppers when healthcare becomes harder to reach. A lot of medical preparedness advice jumps straight to major trauma, field surgery, or long-term collapse. That may grab attention, but it skips the problems most families are more likely to face. For many preppers, the first medical problem during a disruption will look much more ordinary. A prescription runs out while the pharmacy stays closed after a storm. A child gets a fever when the roads are blocked. An elderly parent misses medication because the usual caregiver cannot get there. Someone with asthma struggles because wildfire smoke drifts into the area. A CPAP machine cannot run during a long power outage. A dental problem that felt manageable last week turns into severe pain when appointments are unavailable. None of that requires the end of the world. It only requires normal healthcare to become harder to reach. That can happen in several ways. Storms can close roads, damage clinics, and shut pharmacies. Floods can contaminate water and increase infection risks. Wildfires can affect breathing and force evacuations. Heat waves can hit elderly people, children, and anyone with heart or breathing problems. Winter storms can trap people at home and delay refills, appointments, and emergency response. Cyber attacks can create a different kind of problem. A hospital may still be open, and a pharmacy may still have staff, but the systems they rely on may not work properly. Records, prescriptions, appointments, payment systems, and communication can all become harder to manage. Then there are supply disruptions. Many medications, medical devices, sterile supplies, and basic health products depend on long supply chains. You do not need every product to disappear for the problem to matter. One missing inhaler, one delayed insulin refill, one unavailable test strip, or one backordered medical device part can create a serious problem for the person who needs it. Healthcare can also become harder to access because too many people need it at the same time. After a disaster, hospitals and urgent care centers may still operate, but wait times can grow. Ambulances may take longer. Staff may deal with power problems, damaged roads, shortages, or their own family emergencies. That is why preppers need to plan for delays, not just total collapse. A good medical preparedness plan asks practical questions. Who in your home needs daily medication? Who relies on a medical device that needs power? Who needs glasses, hearing aids, dentures, mobility aids, oxygen, test strips, special food, or regular treatment? Who would have the hardest time if you had to evacuate? Who would struggle if the house became too hot, too cold, smoky, crowded, or stressful? Which medical problem already exists and could become worse if you ignore it? Dental problems belong on that list too, especially if someone already has a cracked tooth, loose filling, gum issue, denture problem, or recurring tooth pain. I will not go deep into dental preparedness in this video because we have a separate guide on that topic. The known dental problems should be dealt with before an emergency makes appointments harder to get. These questions do not sound dramatic, but they expose the weak points that matter. Medical preparedness starts when you look at your actual household instead of a generic checklist. A healthy single adult, a family with young children, a couple caring for an elderly parent, and a household with someone using powered medical equipment all need different plans. The practical goal is simple. Keep ordinary problems from becoming emergencies. Keep manageable conditions under control when normal routines break. Keep information and supplies where people can find them. Know when something has moved beyond home care, and buy time until professional help becomes available. The first place many households should start is prescription medication, because a missed refill can create problems fast. Prescription medication should sit near the top of any medical preparedness plan. For some people, missing a dose may cause discomfort. For others, it can become dangerous. That depends on the person, the condition, and the medication, which is why this part of the plan needs to fit your household rather than a generic list. Start with a simple medication list. Write down every prescription each person takes, the dose, how often they take it, what it treats, who prescribed it, and which pharmacy fills it. Add regular over-the-counter medication too, especially anything someone depends on often, such as allergy medicine, antacids, pain relievers, anti-diarrhea medication, or fever reducers for children. That list should not live only in one person's head. The person who usually handles medication may be the one who gets sick, gets hurt, leaves home, loses their phone, or becomes too busy dealing with the emergency. Next, look at refill timing. A lot of people refill medication when they're nearly out. That creates an obvious weak point. A storm, cyberattack, supply delay, evacuation, or pharmacy closure can turn "I'll pick it up tomorrow" into a real problem. Build the habit of refilling prescriptions as early as your doctor, pharmacy, insurance, and local rules allow. For stable long-term medication, ask your doctor or pharmacist whether a longer supply makes sense and whether it is allowed. Do that before an emergency, not when everyone else has the same idea. Storage matters too. Keep medication in its original container where possible, because the label gives the name, dose, instructions, doctor, and pharmacy. Store it according to the label. Heat, moisture, freezing temperatures, and direct sunlight can damage many medications. A bathroom cabinet may seem convenient, but bathrooms often get warm and humid. Refrigerated medication needs a more serious plan. Insulin and some other medications may need temperature control. If someone in your home depends on that kind of medication, think through backup power, insulated transport, and what you would do during a long outage or evacuation. Ask a pharmacist about safe temperature ranges and what to do if storage gets interrupted. Do not guess. Travel and evacuation create another risk. If you had to leave home quickly, could you grab the right medication in 2 minutes? Would you know which bottles mattered most? Would you have the prescription details, allergy information, and doctor contacts with you? A small grab-and-go medical pouch or folder can help. It should not become a random pile of loose pills. Keep it current, labeled, and organized. Include the medication list, key records, and whatever your household needs to get through a short disruption away from home. Also know your pharmacy options. Write down your normal pharmacy, backup pharmacies, doctor contacts, specialist contacts, and insurance details. A chain pharmacy may access your records at another branch, but that depends on systems working. A paper list still helps when phones die, apps fail, or networks go down. Over-the-counter medication deserves a place in the plan as well, but keep it sensible. Pain relievers, fever reducers, allergy medicine, oral rehydration products, anti-diarrhea medication, cold and flu supplies, and basic stomach remedies can reduce unnecessary trips during minor problems. Always follow labels, watch for interactions, and ask a pharmacist or doctor if you have doubts, especially for children, elderly relatives, pregnant women, or anyone with chronic health conditions. The main warning here is simple. Do not change doses, skip medication, use someone else's prescription, split pills without advice, or treat expired medication as a casual backup because of something you read online. Medication can help, but it can also cause harm when people make guesses under stress. Medication preparedness means doing the boring work early. Make the list, check refill dates, ask sensible questions, store medication correctly, plan for refrigeration, keep records with your emergency documents. Make sure another responsible person knows where everything is. That one area alone can remove a major weak point from many prepper households. Medication planning handles part of the problem. The next part comes down to skills, because a first aid kit only helps if someone knows what to do with it. That sounds obvious, but many preppers get this backward. They buy bandages, splints, pressure dressings, tourniquets, antiseptics, burn dressings, and medical tools, then assume they have solved the problem. Gear helps, but gear does not make decisions for you. It does not tell you when a wound needs more than a bandage. It does not show you how to control serious bleeding. It does not teach CPR. It does not tell you when chest pain, breathing trouble, stroke symptoms, head injuries, severe burns, deep wounds, or allergic reactions need urgent help. Training fills that gap. Start with a basic first aid course. Add CPR and AED training if you can. Bleeding control training also makes sense, especially for anyone who uses tools, firearms, chainsaws, tractors, heavy equipment, or spends time in remote areas. The goal is not to turn yourself into a medic. The goal is to handle basic problems better, stay calmer under pressure, and recognize when a situation has moved beyond your ability. That last part matters. Good training teaches you what to do, but it also teaches you what not to do. That can prevent a lot of harm. A prepper who knows when to stop and seek professional care has a stronger plan than someone who thinks every problem has a home solution. Practice matters too. Do not wait for blood, panic, bad lighting, cold hands, and shouting family members before you open the kit for the first time. Know where your supplies are. Know what the main items do. Read the instructions. Check dates. Replace anything damaged, open, or expired. Make sure more than one person in the household knows the basics. If you are the only trained person, the plan has a weak point. You could be away from home, sick, injured, or the person who needs help. Older teenagers can often learn useful first aid skills. Younger children can still learn simple things, such as where the first aid kit is, how to call for help, and how to tell an adult about allergies or medication. Training should also match your real life. A parent of young children may focus on choking, burns, fever, allergic reactions, and household injuries. Someone who works with tools may need stronger bleeding control training. Someone who hikes, hunts, camps, or lives far from emergency services may benefit from wilderness first aid. Someone caring for an elderly parent may need to think about falls, medication confusion, dehydration, and warning signs that require help. This is where practical preparedness beats random gear buying. You do not need every medical item someone recommends online. You need basic supplies, basic skills, and the judgment to know when a problem needs professional care. So before you add more gear, ask a better question. Can anyone in this house actually use what we already have? If the answer is no, training should come before another shopping list. First aid skills help with injuries and sudden emergencies, but medical preparedness also means preventing problems before they start. That is where hygiene and sanitation come in. A lot of medical preparedness starts before anyone gets hurt or sick. That is why hygiene and sanitation deserve a serious place in the plan. They may not look as interesting as trauma gear, but they can prevent many of the problems that would send people looking for medical help in the first place. Start with hand washing. Soap and clean water do a lot of heavy lifting during an emergency. Dirty hands can spread stomach bugs through a household, contaminate food, infect small wounds, and make a hard situation worse. Hand sanitizer helps when water is limited, but it does not replace proper washing when hands have dirt, grease, chemicals, fuel, or waste on them. Store more soap than you think you need. Add hand sanitizer, disposable gloves, paper towels, cleaning cloths, and a few simple ways to wash hands if the tap stops working. A water container with a spigot can make a big difference. Next, think about water beyond drinking. Preppers often calculate drinking water and stop there. But water also supports hand washing, dishwashing, wound cleaning, laundry, toilet alternatives, and general cleanup. A household can have enough water to drink and still struggle with hygiene after a few days. That connects medical preparedness directly to water storage and purification. If you already have water preps, ask whether they cover hygiene too, not just drinking. Toilet planning also matters. If the water supply stops, the sewer system backs up, or you cannot flush normally, waste can become a health problem quickly. You need a simple, safe plan that fits your home. That might mean a camping toilet, a bucket system, heavy-duty bags, absorbing material, or another setup that makes sense for your location. The goal is simple. Keep waste contained, keep it away from living areas, keep it away from water sources, and make hand washing part of the process every time. Trash can create problems too. Food waste, diapers, menstrual products, wipes, medical waste, packaging, spoiled food, and cleaning materials can pile up fast if collection stops. Store strong trash bags, ties, gloves, and a temporary place to keep bag waste where it will not attract animals or stink out the house. Laundry deserves more attention than it usually gets. Clean socks, underwear, towels, bedding, cloth diapers, washable pads, and wound care cloths can all become health issues when washing becomes difficult. A bucket, plunger washer, washboard, detergent, clothesline, drying rack, and a way to heat water can give you a basic off-grid laundry option. Food hygiene matters as well. Power outages can turn refrigerated food into a risk. Floodwater can contaminate kitchens and storage areas. Stress and poor lighting can lead to mistakes during cooking. Keep fridge and freezer thermometers if you can. Know when to throw food away. Wash hands and surfaces before food prep. Keep raw meat separate from other foods. Use safe water for cooking and dishwashing. Food poisoning during a disaster can cause dehydration, weakness, and a lot of avoidable misery. Personal hygiene needs also belong on the plan. Store toilet paper, menstrual products, diapers, wipes, barrier cream, dental supplies, soap, deodorant, skincare items, and anything specific members of your household need to stay clean and comfortable. These items may not seem medical until you run out of them. Contagious illness adds another layer. If someone gets sick during a disruption, reduce the spread where you can. Give them a separate sleeping area if possible. Improve ventilation. Use dedicated towels. Clean high-touch surfaces. Wash hands more often. Keep tissues, thermometers, masks, gloves, and basic cleaning supplies available. That does not need to become complicated. It just needs to be thought through before half the household gets sick at the same time. Wound care also depends on hygiene. Clean hands, clean water, clean dressings, and clean surfaces matter. A bandage changed with dirty hands in a dirty room can create more problems than it solves. That is why sanitation is medical preparedness. Many emergency health problems start with ordinary things: dirty water, poor hand washing, bad waste management, spoiled food, skipped laundry, insects, rodents, crowded rooms, and small wounds that do not stay clean. You can prevent a lot of that with basic supplies and a workable household system. Hygiene and sanitation help prevent medical problems before they start. But even with good supplies and good habits, information still matters. That brings us to medical records and reference books. Medical information needs to be easy to find when stress is high. A first aid manual, a basic home medical reference, And a few prepper-focused medical books can help when the internet does not work or search results send you toward bad advice. A good book does not turn you into a doctor. It gives you calmer information when you need to make better decisions. I would keep this simple. A clear first aid manual should be the starting point. After that, books like Where There Is No Doctor, Where There Is No Dentist, and the Survival Medicine Handbook may be useful additions to a prepper medical library. I'll link those books in the description for anyone who wants printed references for their preparedness shelf. Use them with the right mindset. Reference books should help you understand basic problems, prevention, warning signs, and when to seek help. They should not encourage you to attempt complex procedures, ignore serious symptoms, change medication, or treat professional care as optional when that care can still be reached. Read the relevant sections before you need them. Mark useful pages. Keep the books where people can find them. A medical book buried in a box under camping gear will not help much during a stressful night. Printed instructions for household-specific needs matter too. A general book will not know your child's allergy plan, your spouse's medication schedule, your parent's device setup, or your own prescription details. That information belongs in your medical folder and care sheets. Good records and good references do two things. They help your household make better decisions when normal systems fail, and they help professionals help you faster when you can reach care. That makes medical records more than paperwork. They become part of the preparedness process. A first aid kit matters, but it is not the whole medical plan. Real medical preparedness means knowing what your household actually needs. It means planning around prescriptions, chronic conditions, medical devices, hygiene, records, training, family care, and the weak points that already exist before an emergency starts. The goal is not to replace doctors, dentists, pharmacists, nurses, paramedics, or hospitals. The goal is to prevent what you can, prepare for delays, make better decisions under stress, and buy time when normal healthcare becomes harder to reach. That could mean having the medication list ready when someone else needs to help. It could mean refilling prescriptions before the storm hits. It could mean keeping a CPAP running during an outage, knowing how to control bleeding, spotting when a wound looks infected, or having the records ready when you need care away from home. Most of this does not look dramatic, but it is the kind of preparation that can make a real difference. If this video helped you think beyond the first aid kit, please like it, subscribe to Prepper's Paradigm, and share it with someone who is building a more complete preparedness plan. I'll link the full website article in the description, along with the first aid kit checklist and a few recommended medical reference books. Thanks for watching. Stay prepared.